Yes, Mr. Chairman, you're live on YouTube.
Thank you very much. Labor and Health Committee will come to order. Let's take a roll call, Mike.
Good morning, everyone. Senator Bouchard. Here. Senator Furphy. Here. Senator Hutchings.
Here.
Senator McCune.
Here.
Chairman Baldwin.
Here.
Thank you.
Good morning, committee. We have a significant change in our agenda this morning. And everyone will be disappointed because I know you wanted to spend 2.5 hours in here contemplating the meaning of life. However, the first thing we got on the agenda this morning won't change, and that is that Workplace Transparency Act 2. And I believe someone on the committee, wow, you're way down there, Senator Bouchard. I almost can't see you through the plexiglass. Do you have an amendment or a motion, sir?
Yeah, Mr. Chairman, I'd like to lay it back. We were going to do an amendment on it and I don't have it ready yet. So
Any discussion or comments from the committee? If there's no objection, we will lay that bill back.
thank you.
That's item number 1 on the agenda. Item number 2, Senate File 129, Medicaid coverage licensed pharmacist. The sponsor has requested that to be laid back. Something about he's busy with appropriations this morning preparing for the onslaught in the Senate. That one we will lay back and probably hear that one on Friday. That's 129. So that puts that one to the side. The third one for consideration is Senate File 151. The sponsor of that bill has also asked for that one to be laid back for more consideration. So that one we don't have scheduled at this point. It may not be scheduled. And that only leaves us with one. And that sponsor, we're going to have to find him, Mike. We're going to have to find Senator Rothfuss if we can. Tell him his bill came up early. And in the meantime, we'll just take care of a couple of committee items that we've been kind of sitting on and not taking care of. And go ahead, Senator Hutchings.
Oh, no, this is just let Senator Rothfuss know we voted on those other bills. We took care of.
Oh, I tell him they were.
Laid back. We took care of them.
Tell them we're fast. We discussed earlier, right before session, when we were actually in virtual, Senator Hutchings brought it to my attention that she wanted to discuss motions and seconds on bills. And I wanted to bring that to the committee because it is up to you. And that is when we move bill. Go ahead, Senator Hutchings. Go ahead and tell us.
Let's lay that conversation back.
Okay. We're laying everything back this morning.
And I'm going to tell you why. I went through Masons and I saw in Masons that it's something that doesn't have to be done. I think it's just something that I've grown accustomed to. I like the thought of seconds. And I was just joking about the laying back. I wanted to just let you know that if that's the way everybody wants to do it, I'm fine with that as well. Just doing moving the bill.
Very good.
Okay.
So we'll continue that custom, committee, that we'll just simply move the bill and move ahead without a second. And if it's a bill that we really don't like or has a disfavor or shown serious flaws in the testimony, then we'll just limit our discussion and move forward and vote on that bill quickly to limit the time.
Thank you, sir.
Okay. Very good. At this point, then we're going to stand by for a few minutes while we get Senator Rothfuss in here to present his bill. And so we're on standby, Amanda, if you just want to hold tight on the feed for a few minutes.
Sounds great, Mr. Chairman.
Mr. Chairman, I texted Senator Rothfuss, so he says he's on his way.
Okay, great. We might. Come on up, Senator Rothfuss. We had some significant changes in plans. Everybody else laid back except for you. Everybody else laid back on their bills except for you. So you're in the spotlight this morning. Committee, we're back in, and Senator Rothfuss is going to tell us about Senate File 154. Go ahead, sir.
Thank you, Mr. Chairman. Mr. Chairman, Senate File 154 is, I'm going to say, my 9th or 10th piece of legislation over the years with the words Medicaid expansion in the title. We'll see how it rolls this year. This piece of legislation is Medicaid expansion with federal match requirements. It's a very simple bill, which is always handy. It's short and everything. But it does some new things, and there's a little bit of a different nuance this year as things have changed with the Federal Stimulus Act that's being passed as we speak through Congress. And so I want to lay out a couple of concepts for the committee, talk about what this bill does and why it does it. And then I think there'll probably be a lot of discussion about whether it is or isn't at this time good political interest. But before we get started, I did send to the committee members, the Senate Labor Health Committee last night, a good bit of background material. I hope you had at least some chance to review that, although obviously there was more than you were going to read between then and now. But I did want to point out that the Department of Health, who, if they're here to provide testimony and answer some questions, did a study just concluded in February with updated figures and information and estimates about Medicaid expansion, the cost to the state of Wyoming, the population that would be covered, the potential effects and how it would be laid out. So one of the nice upsides of the timing of this bill is that we do have a very fresh and well done report that provides recent best estimates as to all of the financial implications and coverage implications that would be available. So I'd encourage if you have any questions really to dig into that report, which has the detailed nuanced answers of how much, how, and when and where. This particular legislation is what I guess is termed a vanilla expansion. When you look on page 2, the A provision is simply an expansion of Medicaid pursuant to the population that is available under the ACA. And we're up to now, Mr. Chairman, 38 states, both red states and blue states throughout the country that have expanded Medicaid. No state has unexpanded Medicaid. So the states have found that it is financially viable. And I should note, when I say 38 states, the District of Columbia has also expanded. So if you count the 51 state metric, then 39 states and the district have expanded Medicaid at this time. I'd remind the committee, or for those that haven't dealt with it before, that traditionally for our Medicaid population, there's a 50% federal match. That's called the FMAP, 50% on most programs. That's certainly not an across the board concept, but most programs are at 50% FMAP. With the federal match due to the CARES Act, there were some tweaks, and I think Wyoming is currently like 56.25% for a temporary period of time because of changes through the CARES Act, but those will expire. Those are set to expire at some point. I don't know what the trigger is for the expiration, but I think there's like 8 quarters or something like that, that's wrapped into the CARES Act. So right now our Medicaid For the most part, again, because there's exceptions and changes over in the CHIP, the childcare has some nuanced changes, and other sections of Medicaid have nuanced changes. But overall, you can contemplate right now that the federal match is at 56.25% for most Medicaid. With the Medicaid expansion population, and that Medicaid expansion population, recall, is single individuals that make less than 138% of the federal poverty level. Single individuals that make less than 138% of the federal poverty level, that's by and large what we're talking about when we're looking at the Medicaid expansion population. And the federal match for that population through the expansion under the ACA is 90%. So it's different from the traditional FMAP. That population then, for every $10 the state of Wyoming spends, the federal government will spend $90 on their health care. Over the available time, it actually started at 100% FMAP, but we're long past the time when we would have received the 100% FMAP. Over the time of available expansion, which has been since, I think 2012 was when we could have started it, if I recall correctly. The state of Wyoming has deferred over $500 million worth of federal aid that would have gone to expansion population, would have gone to the medical and healthcare community in the state of Wyoming to support access to affordable healthcare for those lower income individuals. And again, a lot of times it's transient lower income individuals. You look at the recent pandemic, you look at closures of mines, you look at circumstances that are unanticipated, and folks end up losing their income and end up needing access to this healthcare, which would have been available had they been in another state, an expansion state, where every state surrounding us at this point in time, with the exception of one that I believe we touched, has expanded Medicaid. So if they were in any of our neighbors, they would have had coverage, but by being in the state of Wyoming, they had no access to affordable health care. So this legislation is intended to take advantage of a component which is present in both the House and Senate draft of the new Stimulus Act, which is now back in the House this morning, the US House of Representatives, back in the US House for consideration for concurrence effectively. And I think there's an expectation there'll be concurrence either today or early in the week, and then it would be signed in the near future. So they have mirror language that says that for those states that have not yet expanded Medicaid, Wyoming, for example, Texas, Florida, a few others, for those states, if they were to expand now, they would receive a plus 5% to their FMAP on the non-expansion population. That's the better one. We want that more because there's a lot more folks in the state of Wyoming that are covered. Let me just go ahead and use my verbiage correctly. That are covered at the 50% or 56.25% than there are or would be at the 90%. So that is an intentional enticement. That's just the feds trying to guide our actions through dollars, but they've done it before. They'll do it again. And we haven't been too bashful in the past to take their money typically. It's an enticement for us to expand that is worth $120 million estimated over the next 2 years. The additional administrative cost, the 10% share plus administration for the Medicaid expansion population, is $20 million roughly each year. So roughly a $40 million cost. So expansion for the next 2 years is a net revenue increase to the state of roughly $80 million. I'm going to say that again. It's a net revenue increase to the general fund of $80 million for us to expand Medicaid for those 2 years that we wouldn't otherwise and won't otherwise have, while simultaneously providing and covering the healthcare costs for an additional 24-ish thousand Wyomingites. And again, that's an estimate. And you can see in the Department of Health report Very detailed, very thoughtful, and very well modeled estimates that give you a range between, I want to say 17 and like 31,000 is the range that is predicted. And there's always concern with the idea that we'll go too high. And that's been one of the complaints, is that, well, the folks, when they come out of the woodwork, will exceed the 24,000 estimate. The original estimate, incidentally, was more like 20,000. The department has increased the estimate by 4,000 over the years, based on looking at how it turned out in other states, right? We've got 39 data points to look at now, leads to a better estimate. I've always contended that, honestly, the more people we cover at 90%, where we get $9 on every $1 we spend by the feds, I'm happier. I wish we could extend the Medicaid expansion to every single person in the state, get $9 for every $1, and then spend the savings elsewhere. It'd be great. That would be our biggest win in terms of federal funds. I know not everybody shares that view, but that's certainly the way I look at it, because we do pay quite a bit of federal taxes, and it's money that was actually built into the ACA in terms of taxation, and we've refused to take and accept the programs that we've paid for the past 8 years through our taxes, out of whether it's spite, principle, whatever else. For one reason or another, we've refused to accept the programs that we paid for. But we paid for them in other states, and those states send their regards and appreciation. Mr. Chairman, the way this is structured, then, when you look at Section B, based on the background that I gave about increasing the FMAP, we've always had a kick-out provision in every Medicaid expansion bill that we've had before, where if the federal match for the expansion population dropped below 90%, in other words, if they backed out on their end of the deal, then we would back out on our end of the deal, Mr. Chairman. We've upped the ante in this bill. In this bill, if the FMAP on the traditional population drops below 55%, which there should be every expectation based on current policy that this will happen in 2 years, we would drop out of Medicaid expansion. The hope that I have, the state of Wyoming gets a pretty raw deal when it comes to our FMAP. There are only a handful of states that get a 50% FMAP. Some southern states get up in the 70s, 70% FMAP. That's hundreds of millions of dollars if Wyoming got a 70% FMAP. And the calculation for that is based on the mean household income of the state, which turns out in Wyoming to be very high. At the same time, it completely neglects any consideration of the healthcare costs in the state. My hope is if we pass a bill like this, where the onus then shifts from the state of Wyoming to the US Congress, where Congress at that point would be canceling the expansion population on the state of Wyoming if they don't take action to recognize the healthcare costs in the state of Wyoming and permanently do something about the FMAP calculation. If they don't do that, our expansion drops. If they continue at 55% or above, if we can use this to provide leverage, right? They're leveraging us by giving us the $120 million. It's my suggestion to the Senate and then to the House that we take this leverage, we shift it back on them, and we say, all right, 55% is a lot more fair. So why don't you sustain that? In fact, we'd take 60, but 55% makes this a net profit proposal for time and eternity. The state will always be coming out about $40 million ahead in general revenue. So instead of a tax increase, which we're talking about, the idea that we can put on the table $40 million per year of additional revenue for the state of Wyoming so that we can cover and provide access to affordable health care for 24,000 Wyomingites. I see that as a real win-win, Mr. Chairman. That's what this bill does. I'd answer any questions.
Thank you, Senator Rothfuss. Questions committee, Senator Hutchings.
Thank you. Yo, let's do, what is that, Dolby sound? I have to rush off, so I'm gonna give you a list of questions and then I'll hopefully be able to hear them later, the answers if possible.
Sure.
I'm not enticed by the federal enticements, and I kind of don't like that they're doing that. And then my my first question is, you have a 90% match FMAT for the new people and a 56 for the old. Can you explain that? You talked about $20 million each year for administrative costs. Can you go into that? And one of the things when I was doing a little research on Medicaid expansion is the number of those who enroll is always more than expected. I mean, it's not like we're saying 10 people can enroll in Medicaid in this new expansion. I'm talking about hundreds of thousands. Not that we have that many in our state, but more will probably enroll than expected. So what are your little safeguards with that? And then my biggest question, the biggest question I have, and I sent almost everybody I could, the US debt clock. Where in the world is this money gonna come from? Thank you, Mr. Chairman.
Senator Rothfuss, did you write all those down?
Yes, of course, Mr. Chairman.
All right.
Go ahead.
Thank you, Mr. Chairman. Mr. Chairman, addressing Senator Hutchings' questions, and while she's here, and I'll just continue after she leaves. The first is that she's not enticed by the federal dollars, and I understand that. It gets back to some of the concerns that she raises later about the fact that they will effectively be debt funded. The reality is we did pay taxes, and there were tax increases built into the ACA. Some of those were canceled out, but at the end of the day, it was taxes and fees that funded the ACA in the beginning, and theoretically continue to, although some changes in Congress have been made since that time that lead to it probably being a net draw. We have not used our taxes. So they were our dollars. We just sent them elsewhere. There's no question right now with the first CARES Act and the new Stimulus Act that these two acts are unquestionably deficit spending, and they will go towards their debt. Medicaid expansion in Wyoming is not at fault for that. And Medicaid expansion or not expanding Medicaid in Wyoming is neither going to cure nor substantially exacerbate that. This same offer is being offered to Texas and Florida because they're not expansion states. The enticement for Texas is about $5 billion. I think they'll be hard pressed to turn that down. Florida, it's about $3.5, I think, billion. You've got that in the files that I sent out last night. The $120 million for Wyoming of enticement that's in the stimulus is just not the culprit when it comes to the debt and the deficit of the country. There are a lot of other things we probably need to solve before we solve this. With regard to the concept of that enticement and being where we are, I would just note again what I've noted over the years, each time that we've looked at this. If not this, then what? We have a horribly flawed healthcare system in this country. There's no question about it. It's one thing that I think there's a full bipartisan agreement on. We might not agree on what the right outcome is and what the right solution is, but I think we can all look at it and say, wow, that's broken. That's not the system we want. In Wyoming, though, we've only taken the step of looking at things and saying that's not what we want. For the whole time I've been in the legislature, the healthcare circumstance in Wyoming has gotten worse and worse. Costs have increased. Cost of health insurance has increased. Challenges for our providers have increased. Challenges for our hospitals have increased. We'll hear that testimony. This legislature has done nothing in response to those challenges. So once again, I'll ask on this bill, if not this, then what? I'm open. I'm looking for solutions. I'm looking for ideas. I say that each year. I'm met with silence each year. If not this, then what? Most of the circumstances that surround our healthcare decisions, regrettably, are decided by the feds. They're baked into federal legislation. We don't have a lot of flexibility. And we're dealt a hand. And that hand might be a lousy hand, but you kind of have to play it sometimes. And this is part of the cards we're dealt. So I understand that there's a desire not to take dollars from the feds and not to do what they're suggesting we do. But again, I'm open to other ideas. If there are better ideas than receiving back the taxes that we paid on legislation that we may or may not have agreed with, to use them to support the people of Wyoming, if there are better ideas out there, then, bring them. Second question was with regard to the 90% for the new population versus the 56% for the old in the FMAP, and could I explain that a little bit further? That was built into the original intent of how the ACA was going to cover its populations. Those that are above 138% of the federal poverty level were going to, through 400% of the federal poverty level, were going to have their access to affordable healthcare needs addressed through the exchange and through a series of tax subsidies and or credits that would augment their purchasing power in a way that theoretically was going to provide access to affordable healthcare. And that's where you get your bronze and silver and gold and platinum level plans. That was the intended approach to address the 138% of federal poverty level to 400. In the original ACA, the intent to address those below 138% was through states' existing Medicaid plans. But when the ACA was being passed, there was a desire to fully fund that at the beginning and then drop that funding to a 90% FMAP, 10% state obligation over 7 years, which has already taken place. So it was creating a new classification of coverage for Medicaid that had not previously been a part of that population. And as such, it was rated at a new calculation, which was uniform for all states instead of using the traditional FMAP population. And that's why the 90% is different from our 56.25 or traditional 50% FMAP. The $20 million for the administration per year. If I said only administration, my apologies to the committee, I misspoke. The $20 million expense is the administrative cost portion plus the state's 10% portion. In other words, it's effectively $20-ish million. And I say ish because it's an estimate. And you can see the estimated range in the report that was recently developed by the Department of Health and probabilities for the different range. But again, you can think it might be 15 million at the low end, and I think it went up to 27 million at the high end. And those numbers depend very specifically on a couple of factors, which again are described in the report. The first is the number of people that come on. And then there is always included in that, and other states have shown this experience as being true, the idea that if you have had a backlog of failed access to healthcare, then you'll get that backlog of healthcare services addressed at the front end of when you have coverage. So there's an expectation that as somebody who was previously uninsured comes on to Medicaid, that they'll be more costly in a per member month at the beginning, and then that will decay, and that's taken into consideration too. So that's the 20-ish million, and I'd refer you to the report for more details. The idea that in other states, the number that enrolled was higher than our estimates. Our original estimate was based on the same formulas that were used in other states that led to lower initial estimates than projected or than actually realized. This is, I think, the fourth time our state experts at the Department of Health have looked back to reassess those estimates based on the experiences in other states. So while that was true before, when our estimate was around 20,000, our estimate is now around 24,000 for the reasons that were suggested by the good senator. Yes, probably will be a little bit higher than we expected when we estimated it 8 years ago. Now, 24,000 is probably pretty reasonable. And as I said a few minutes ago, though, honestly, if it comes to 30,000, we're at a time now where we're trying to look for ways to stimulate the state's economy. And I know not everybody is as enthusiastic about using federal funds to stimulate the state economy as I am. But at the end of the day, you know, the money is still money that's going to fuel our economy. And if we're providing resources to our healthcare sector, that's helpful for our economy in an economic downturn. So if 30,000 people are covered, that means that we bring in $9 new for every dollar of state funds that we spend in the state that goes into the healthcare sector. That's jobs, that's revenue, that's money that's spent locally in the communities, buying things, leads to sales tax, leads to jobs, fuels the economy. We understand that. I mean, it's simple economics that the more money you bring into a system, in this system, you typically end up having positive economic returns. And then the final question that I believe was addressed was, where are the safeguards coming from with regard to the expansion population size? There's intentionally no safeguards. Again, I said before, if the numbers go high, they go high because there are folks that have fallen below the 138% poverty level. And that's the case right now. We have a lot of people that are struggling because of the pandemic. This will help them get back on their feet and provide them with affordable access to healthcare, quality healthcare, while they're doing that. When they get back on their feet, they'll roll back off. You have in the report quite a bit of data showing the cyclic nature of access to Medicaid. So that addresses the 5 questions. Mr. Chairman, I'd be happy to answer any more.
Just for a point of clarification before we go to Senator Furphy, can you clarify that 138% of the poverty income? Do you know a number on that as far as Wyoming income?
Mr. Chairman, I have an obsolete number, but I would be willing to bet we can get an accurate
Somebody
number.
back there is shaking their head. So when they come up,
Yeah,
they can
let's
share it with
have
us.
them answer that. Mine is three or 4 years old.
That's valuable for the committee, and
Yeah.
which brings another point to mind. If you ever have a chance, committee, NCSL has a program called Medicaid 101 for discussions like this. It's a good program to go through because we talk about Medicaid a lot. So with that said, Senator Free, go ahead, sir.
Thank you, Mr. Chairman. Senator Rothfuss, let me say, first of all, thank you for providing the Health Department report. That helped bring me up to speed, and the other 2 reports you provided. My question to you simply is, if the federal government drops below the 90% match, as you're indicating in your bill, are we really, those 24,000 people, are we, if we have to back out, are we really in any worse condition than we are now without this expansion? Thank you, Mr. Senator.
Mr. Chairman,
Go ahead.
Senator Furphy. Sorry, I used the old Representative Furphy there for a moment, but Senator Furphy. Senator Furphy will be better off. These are individuals that will have had 2 years of opportunity to get their healthcare needs addressed. Hopefully that will get many of them back on their feet. Hopefully that will help to improve and bolster things. And hopefully we'll come up with some better ideas and put other plans in place. It's very difficult to plan a perfect solution for the future and for time and eternity. We can't do that, but we know that we can improve things for the next couple of years. And it'll give the legislature a chance to see it in action in Wyoming. And we would certainly, if we chose and said, well, we want to keep this even if it goes to 54.7, we can do a special session if that's our need, or we can not. I mean, we're a legislature that's empowered to make those changes. I see no downside, and I guess I would ask the other folks that come up and provide testimony the same question, Senator, Mr. Chairman, because maybe there is some type of downside to having it for 2 years and then losing it, but I don't see that. I know from the federal standpoint, it's very clear that there is no downside and cannot be any downside. In fact, that's sort of part of the Supreme Court decision made it clear that we should be able to isolate this. And so, no, I don't see a problem. I would find it disappointing if that took place, but we would be better off for the 2-year experience. Thank you.
Further questions, committee? No hands going up. Thank you, Senator Rothfuss. I will include that this is the 7th time this is my 7th session that I've talked about Medicaid expansion. And I would add that one of the highlights of my legislative career happened that very first session in a House committee meeting. Some of these folks might have been there. The only time I've ever seen a representative get thrown out of a meeting.
I was there. I
so that
remember
was-
it well.
That's a highlight. When I write a book about my legislative career, Medicaid expansion will be included.
Mr. Chairman, I think I was presenting at that point, if I'm not mistaken.
Probably. It was very memorable. Thank you very much, Senator Rothfuss. I would first ask Amanda, do we have anybody from the Department of Health in the waiting room?
We do, Mr. Chairman.
Let's go ahead and admit them in, please.
If anyone from the Department of Health can raise their hand on the Zoom feature.
We do appreciate all of you out in Zoom land, by the way. You're hard to see through our plexiglass, but we appreciate you coming this long distance through the airwaves to speak to us.
Good morning, Mr. Chairman, members of the committee. My name is Franz Fuchs. I'm with the Department of Health.
Welcome, Frank.
Jesse and I are here virtually to answer any questions you might have had. Jesse's has deep knowledge of the Medicaid program, and then I am the main author of that report you may have received. So I'm happy to answer any specific questions to that.
Very good. Committee, do you have any questions for Franz or Jesse? The two most knowledgeable people about Medicaid that I know. Jesse knows a lot more than I know. Any questions for these folks? There we can see, oh, there he is. Beautiful picture behind your head there, Jesse. Any questions for Jesse, committee, or Franz? Go ahead, Senator Furphy.
Thank you, Mr. Chairman. Well, I might ask them the same question that I asked the senator. If we were to back out, if the federal government drops below 90% match, are we any worse off than we would be now if we don't expand? Thank you.
Go ahead, Jesse.
Chairman Baldwin, Senator Furphy, the logistics of backing out would be the same as the logistics of going in. So you'd file a state plan amendment. You'd go through the regulatory things that you need to do that. We would be following Wyoming statute in that case, so it would be pretty automatic. I think you know, I can't speak to like whether the healthcare system would be better in 2 years, but I would think, you know, this level of resources for 2 years for the healthcare system and also for the people getting this healthcare, they would be better off for having had healthcare for 2 years. I mean, most people would, I think, go get, you know, some sort of long-term problem or, you know, fixed. And then, you know, if it went away, they would, and that's the idea of that surge. So there's some sort of pent-up healthcare demand that's been unresolved. And so that's usually why these type of proposals have front-end money, because there is some sort of pent-up demand that has to be paid up. And then after those, usually it's projected to be a year or two. After that time period, then the cost starts to drop and normalize. And we've seen this in other programs. So Wyoming did a small insurance program, and it, you know, had high costs to begin with, and then had stabilized at the end. And then once it was announced it was going away, it had a small spike.
Thank you. Further questions, committee? No further questions. Thank you very much, Jesse and Franz, even though we can't see him. Are there any other agencies or departments out there who wish to testify? I see a hand. I'm sorry, I can't see everybody's names. Go ahead.
Mr. Chairman, I just want to let you know, we have about 40 people registered to testify, and they're kind of all raising their hand at one time. So I don't know if you want me to move them in.
Really,
or if you,
all I want right now, Amanda, is just the agencies and departments, and then we'll set some time limits on the general public. I've got a few agencies here to testify in the room. So right now, all I'm looking for is agencies or departments. So Department of Health, Department of Insurance, et cetera, right now.
Okay, if I can ask those that are registered to testify to turn off their video if I've let them in, if they are not an agency. And those in the waiting room, if you can please raise your hand only if you're an agency.
I'm assuming there's no more hands coming up.
One did come up, Mr. Chairman.
Okay, let's admit that one person in, and then we'll get some testimony here in the room after that one.
Dasa Robertson had their hand raised, so I think they might be an agency.
Nice count.
Yes,
Go
yes,
ahead.
good morning. Can you hear me?
Yes, you're fine. Go ahead with your testimony.
Yes, I am actually with Enroll Wyoming, and my name is Dasa Robertson. I'm a navigator. I help with the Affordable Care Act. I help people get signed up for health care. I am a Wyomingite. I've lived here for 56 years, first in Goshen County, then over into Albany County, and I'm now living in Cheyenne. In that time, I have been a case manager. I've been a victim advocate. I was a victim advocate for 14 years, and was a case manager for 3. I've been with many, many victims, many persons who are at the lower poverty, who were not able to get Medicaid, who were injured, who had medical costs, outrageous medical costs because they were victims of a crime. And we're not able to, and healthcare can derail you quickly. It can cause you to lose your home. It can cause you to lose everything you've worked very hard to get. I have worked with victims of domestic violence that ended up in the safe house with no kind of healthcare, no kind of ability to take care of themselves. They might have Medicaid for their children, but not for themselves, and they have suffered injury. And what are they to do if they are to go to the hospital, and the hospital then has to cover those costs? When you put a victim in that kind of serious problem of trying to make bills and added stress on top of what they've already been through, it's hard to help them to get through their victimization. And it is a re-victimization because they continue to have to pay for their medical costs, or they're going to lose what they do have because they can't afford to pay for their medical costs. And as far as working in Enroll Wyoming, I have run across many individuals, and it's very sad when they don't make that 100%, and they're so excited because they think they can finally get the quality health care that they really need and they really deserve, but they don't qualify because they're beneath that 100%. It's sad, and it's hard to, as a navigator, to tell them, I'm sorry you don't qualify. It's really hard to do, and it's sad to tell them, I'm sorry, you aren't going to get the quality health care that you think that you deserve, that every individual in Wyoming deserves. If you have any questions, I'm happy to answer them.
Thank you very much. Any questions, committee? No questions. Thank you very much for your testimony. We'll move now into the in-room. If we can get perhaps the Hospital Association to come up first, we can get some numbers. Welcome to Labor and Health, gentlemen. Go ahead and introduce yourself and tell us what you got to tell us.
Thank you, Mr. Chairman, members of the committee. I'm Josh Hannes with the Wyoming Hospital Association.
Mr. Chairman, Eric Boley, President of the Wyoming Hospital Association. I'm going to, if it's all right, Mr. Chairman, we're going to tag team this a little bit. And Josh has been working closely with a coalition of folks that are interested in this topic. We've been working on this, obviously, since Medicaid expansion became a possibility. And I think a lot of really good questions have been asked today, and we hope to provide that information to you. Senator Rothfuss did a great job walking through the bill. There are a lot of topics that we've covered, and you'll probably have more questions and answers by the time we're done. And I think in the interim, we can help really do some education on FMAP and some of those things. But with that said, one of the questions was the poverty, the level of income to qualify for this. When we looked that up, we think it's right around $24,000, and that's for a family of two. The other thing that we'd like to share with you is we're talking about numbers is I think estimates show that 76% of the population that could be captured under Medicaid expansion are single mothers with two children. We talk a lot about the working poor, and there are a lot of folks out there that are working for low wages that don't qualify because they don't make enough money to qualify and be able to get any help with the exchange, nor could they afford the premiums. And they would fall in this category where they could have coverage. And I think we can talk a little bit about the importance of that coverage. But I'm going to let Josh jump in here if that's okay, Mr. Chairman.
Thank you, Mr. Chairman. So as Eric said, coverage is a major component of having access to care. And in Wyoming, there is a population of people for which there just is not an option. There's not a pay source that they can tap into. And so what you'll see happen, and Senators Baldwin and Bouchard, you've been down this road with us many times and heard this, is that when people don't have access to primary care, the front door to the medical system becomes the emergency room, which is an inappropriate place for care and a wildly expensive place for care, particularly if you're uninsured. What expanding Medicaid does for this population that doesn't have another option is changes their ability to access healthcare in the right place and at the right time. Now, obviously, there are long-term positive health effects of having that access, but I'd also turn your attention to the Department of Health's report, which provides or which states to their study that you could potentially see decreases in the individual marketplace by expanding Medicaid from 5 to 15%. That's not guaranteed, it's an estimate, but it is another downstream effect of providing access to these folks that would impact costs across the healthcare system throughout the state. Now, again, and most of you have heard this, is that hospitals in Wyoming take on tremendous amounts of uncompensated care. So care being provided for which they're not reimbursed. And that number is typically in most years right around $100 million, sometimes a little higher, sometimes a little lower. And so what are the impacts of that? So every dollar that's spent covering uncompensated care is money we're not investing in equipment. It's dollars we're not investing in new physicians and providers. It's money we're not investing in updating and maintaining our physical plants, some of which are aging considerably. I would add that, like Senator Rothfuss said in his presentation, that states that have expanded Medicaid have not turned it away. There's a reason for that, and there's a number of positive effects that states see to their state's budgets and to people being able to access care in the appropriate place. The argument has been, or a argument has been, that Wyoming can't afford expansion. I think it's been demonstrated today that there's an opportunity now where we can afford expansion. And I think it's still the right thing to do. And I guess the final thing I would say is, again, to Senator Rothfuss's point about, if not this, what else? And I think some of the absence of an alternative plan is because of the quality of this plan and what it brings. I know there's some pushback to expanding Medicaid and creating coverage for this population of people, most of whom are working, most are women, most have children. This is an important policy that has positive effects across the spectrum of healthcare. And I think it's time that we move forward and advance this policy for people in Wyoming.
Mr. Chair, a couple other comments, and Josh has done a great job. I think one thing we'd like to clarify is we talk about the $100 million worth of uncompensated care that's given away annually. That $100 million isn't based off our charges. That's the actual cost of delivering that care. So charges are much higher. We're not even into that. We just want it to be clear that that's the actual cost of delivering that care. A couple other things that I wanted to touch on, and I think this goes back to Senator Furphy's question, is what happens if after 2 years we fall below the FMAP and we back out? We believe that we have folks out there that need to have care, and they're not seeking that care right now. So when they finally do come into our hospitals, when they finally see the doctors, they were sicker than they should be if they had coverage. And so what we believe will happen, and what we've seen happen in other states, is folks that don't have coverage will now start seeking coverage. They'll seek coverage in appropriate places. We can help them manage their chronic diseases and their illnesses, and we can get them on a healthier path in life, which in the end costs everybody less money, and we have a healthier population. The argument that's been for 7, 8, 9 years is, what if the federal government backs out on us? And we have turned this down for years because we keep saying the government could change. The government's invested in this. The government is part of the ACA, and we continue to turn our backs on this opportunity to take care of our neighbors. We've given up millions and millions of dollars, and you know, one of the questions was about where the pay for this came from. We are paying for it. Our industries are paying for it, but we're paying for it in other states. On top of that, healthcare professionals across the country took cuts in their Medicare reimbursement when this was originally started, to the tune of $155 billion, so that other people could have coverage. And so the pay-fors are there. We've already paid for a lot of this, but we haven't reaped any of the benefits and made sure that folks have coverage that they need. And so I think that our concerns about the feds backing out is really unfounded, and it actually, we're showing an increase in their desire to help make sure there's coverage for this population. I think the final thing that I would say, and then we'll answer any questions that you have, is my belief, our belief, is this is not really giving a handout to people. This is giving them a hand up. As we look around our state, as we look at what's happening in some of the communities we hold dearest to us, we have folks that are losing their jobs now because of the downturn in the economy, things that are happening in the oil and gas industry, the coal industry. We're dealing with a different population than we were 7 or 8 years ago, but these are our neighbors that don't have coverage right now, don't have health insurance. This would give us a chance to help them have coverage until they can get back on their feet. And we think it's the right thing to do now. We've thought it's the right thing to do for many, many years, and we would ask you to advance this out and see if we can do something to help our neighbors. With that, we'll answer any questions.
Questions for the Hospital Association Committee? No questions. Thank you, gentlemen.
Thanks, Chairman.
Anyone else in the room that wishes to testify today? Ms. Bush. And just as a heads up, once we're going to cut off testimony about 9:40, so we can work this bill in the committee and move forward. So there will be some time limits on those after Ms. Bush. Go ahead.
Good morning, Mr. Chairman, members of the committee. This is my first time in front of you this year, so I'll take a minute to introduce myself. My name is Sheila Bush, and I represent the Wyoming Medical Society. The State Medical Society is an organization that represents PAs and physicians across the state with just under 1,000 members. I'm here in front of you today to support Medicaid expansion. We've been consistent in this position throughout this process. And I did, in addition to what you've already heard, wanted to add a little of perspective from the physician side and PAs. So we all know healthcare in our country isn't perfect. It has a lot left to be improved upon and changed. But as the system is today, expansion does a great bit of good in helping move things forward. In the United States, healthcare is nearly 20% of our GDP. It's a very big number. Part of that is that we're taking care of conditions later when they are far more expensive. We know that we save money when we focus on primary care and preventive medicine, when we can catch conditions early and give people a support system to address those conditions, disease states in a more affordable way. Medicaid expansion helps create and foster a system that allows us to do that. In primary care, it's It's a way to have patients create an established relationship with a provider where they have an opportunity to voice concerns when they're minor. Our system isn't developed to support low-income people or the working poor to have access to those services. Right now, we wait. Our system is really structured to incentivize them to wait until conditions are very serious or potentially an emergency, and then they access the healthcare system. And all of us still pay for that care when that happens. It just happens in the most expensive possible way. I think expanding Medicaid is a really good way to support primary care in the state. We want patients to stay home. We want them to stay in the state. We don't want them to seek care out of state. If we allow them and create a system in which they can find that care locally at a more affordable rate, they can stay home. If we wait until conditions are far more serious, and often is the case that they need subspecialty care that we don't provide in our state due to a low population. And so by not really seriously considering expansion as a means to create a primary care infrastructure that really focuses on preventive medicine, we push patients out of state in some cases because they have to go elsewhere to seek far more specialized treatment as their conditions worsen. So with that, I will close. I appreciate your time. If there are any questions, I would stand for those.
Questions, committee? Senator McEwen, let me say that right. I said it wrong again. Go ahead, sir.
Thank you, Mr. Chairman. We find ourselves in this situation and it kind of angers me. And it's nobody in this room's fault. So my question is, when does it end? In 2007, 2008, I bought a grocery store. We offered health insurance to the lower class working people. Then some guy came along and invented a law or a new healthcare system that was going to be better, which literally made what we were doing illegal. We could no longer offer health insurance because they wanted them on the federal system. So while I think this is a great plan, my other question is, what are the strings attached to this from the federal government? Having served in the Army and living overseas, I'm going to tell you, you don't want socialized medicine. I saw it and it's bad in my mind. So, in Senator Rothfuss, that was a great question. What do we do? I don't know how we get the federal government out of the healthcare business, but that would be my answer. And I don't know if we can. So as we look at this, when does it end? Are we going to have federally run hospitals? And really, that's my question and the point I want to make, so you don't think I'm an absolute ogre later. Thank you.
Thank you, Senator McEwen. A simple question. Go ahead and answer that, Ms. Bush, if you would like.
Mr. Chairman, Senator McEwen, I recognize and appreciate the concern. I think healthcare right now, it's a little broken, and we all can be on the same page with that. We just, the real questions come in how we fix it and getting to the same page together. I think it's probably a patchwork quilt where everybody has a role to play. There's personal responsibility that needs to be a component. It's a multitude of factors. Right now, with what we have today, we think that this is a really positive step forward in that patchwork quilt. We don't think it's the end point. We think it's one small step towards something bigger. And it's not an effort, excuse me, at least in our state, to move into a fully socialized program or the federal government running all of our hospitals, not in any way. It really is just with what we have today, with the resources that we've been given. How do we hold our state together in our current economic crisis? How do we support healthcare? It's probably not perfect. In fact, I'm positive it's not. But it's what we have today, and we think it's the best answer available to us.
Further questions? Go ahead, Senator McEwen.
And I empathize with that. but it seems like we're headed down a slippery slope. It might fix it now, but at what cost? And I'm not necessarily against the bill. It's just, when do we say enough's enough? If that makes sense. Thank you, ma'am. Thank you, Mr. Chairman.
Mr. Chairman.
Go ahead.
Senator McEwen, I hear you. I think what we have right now, though, we're already in some ways there. And I think that sometimes it's difficult to recognize that the system we have today that isn't up for decision at all already forces our hand to care for people. It's just that we do it in the most dysfunctional and the most expensive way possible. And so is that great? Do I think it's perfect? No, not at all. But if we take the system and look at the reality of what it is right now and how broken it is, this is a means to at least start attempting to fix it. And it might be a roundabout way, and it might be counterintuitive to core beliefs that we expand in order to address the problem. But I do truly believe it's there. And in my 15 years of healthcare policy work, the more you learn, the more you scratch your head. And it's just the reality of where we are. But it's already a system where we pay for those services. We're already obligated as a country because of laws passed in the 60s to provide this care and to do it out of our pockets. This is just a way to do it in a far more affordable and truly more humane way in giving people the care they need early when it's more affordable.
Thank you. Further questions, committee? No further questions. Thank you. Are there more in the audience who wish to testify today? Back row first, and then we'll move to the front row. Welcome to Labor and Health. Introduce yourself and speak.
Thank you, Mr. My name's Nate Martin. I'm the director of an outfit called Better Wyoming. It's interesting for me to listen to Senator Rothfuss and some others talk about being kind of fatigued over this issue, having dealt with it for 7 years, because I've been looking at the issue of people not being able to afford health insurance since I was about 10. That's when my dad's best friend died. Levi Herring, over an encampment where my dad grew up, worked in the timber, worked as an outfitter, but he had type 8 diabetes. And as his health deteriorated, he had a harder and harder time making ends meet. And towards the end, he was making the decision weekly whether to put food on the table for his son or to buy the medicine he needed. He died when he was about 43 years old. And I've been watching this happen for the rest of my life in Wyoming. The Department of Health estimates 24,000 people would receive basic access, basic insurance through this program. I do think that number is growing, and it's growing in places like my hometown where I grew up in Rock Springs, places like Gillette, places like Kemmer, where the energy industry is struggling. And there used to be a fiscal argument from the state's perspective against this. There's not any longer. You know, you can have ideological stances against federal funding, whatnot. You know, I don't disagree with you that you don't want socialized medicine, but if you don't have insurance, you want something. And it's interesting to me talking to more and more people around the state. You know, the folks who work at your grocery store don't know what an FMAP is. But as they can see other people in other states having access to basic insurance, more and more people are starting to understand what you all are stopping them from having effectively. There's a lady who works at the dollar store in my neighborhood, or she used to. She got cancer, you know, and she's far from a policy expert. But after getting a $250,000 surgery and treatment, you know, and now she has to pay hundreds of dollars every month out of pocket because she went to the state and applied for Medicaid and was told that her construction worker husband makes too much money for them to qualify, and she's just going to be stuck with the bills. You know, she's just flabbergasted. You know, she might be here on the call today. I don't know. I told her to come. You know, she said, I worked my whole life. I did everything right, paid my taxes. And when I asked for a little bit of help, she didn't ask for cancer. She had a tumor the size of a grapefruit in her body. But more and more people are starting to understand what Medicaid expansion means and what we don't have. And yeah, I mean, it's not the perfect solution. It's not the end game, but people are dying right now. Those 24,000 people who would have eligibility to receive this, those are the people who are getting sick and wondering whether they're going to put food on the table or go to the doctor. And people understand too that the legislature doesn't have to deal with these questions. They know that the people up here in the Capitol, y'all aren't worried about getting sick because you're going to have insurance. And so it's kind of this perspective. Every time you turn this down, you know, telling the people of Wyoming, you know, I got mine, but forget about you. So I'm asking you to pass this bill, please pass it out of committee, have a conversation on the Senate floor about it. Nobody's asking for anything that you all don't have. I stand for questions.
Thank you very much. Questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. You know, I hear the push, but I mean, I've actually been watching a Medicaid fraud case that it's almost like nobody cared. I mean, we threw away a lot of money, and there's still property that's being held that should be sold to repay the state back the money. And nobody cares about any of that stuff. And I think what I look at is the Affordable Health Care Act. It didn't turn out to be so affordable. And the push was they dropped Medicaid out of that whole equation. And now we're sitting in a position we're going to push this so we can expand. I just don't want top-down medical care anymore. I mean, this is getting ridiculous. I mean, to where, and look, I'll even talk about a case where even when I had insurance and we pay $5,000 for a doctor to tell us that we poisoned our daughter with Tylenol, and we had to take her out of the hospital and take her to another hospital. And to this day, my wife says, I just can't believe we spent that kind of money for that kind of diagnosis. I think there's a whole lot of other problems that need to be fixed. And we're just never talking about those problems. We're not talking about how the costs keep increasing. We're not talking, and this isn't going to do that if we don't have oversight. All we're going to do is throw more money at the problem. And we need to fix these problems that are happening over in the beginning of the healthcare. I mean, look, we've got Affordable Health Care Act. We've got people who now are paying premiums that are through the roof. In my time in the Senate, we had a bill to put a tax on another insurance that doesn't even deal in health, to tax them more on incidental insurance to pay for the increases in the costs on Obamacare. And I'm just going, we're going to hurt incidental insurance by charging them more, so we can offset the costs on the premiums on healthcare. That was a bill that came a couple of years ago. We just keep saying, how are we going to throw more money at a problem, but we're not looking at how we're going to control these costs. So that's what I'm not hearing here. All I'm hearing is let's throw this money at it. We're going to get ourselves stuck in a system we can't get out of. And we really have a lot of power at the state level to fix things here. We're not doing it.
Mr. Chairman.
Comments? Go ahead, sir.
Sure. I'm not quite sure what the nugget of that question was. It seemed like a bunch of what about this and what about this and what about this. Yeah, premiums are going up. That's why a lot of more people can't access healthcare. That's why a lot of more people are dying who need insurance coverage. You know, if the state has a lot of power to fix problems, do it. Like I said, let's go. And in terms of throwing money at it, the state's actually not throwing any more money at it. As Senator Rothfuss said, these are tax dollars that people in the state of Wyoming already paid to the federal government that are funding Medicaid programs in other states, but not in Wyoming. And like I said, people are beginning to learn what we are not providing them.
Thank you, sir. We're going to go ahead and move on to the next
Thank you.
testimony. Thank you very much for coming and testifying. I would notify those who are going to present. We're going to begin a time limit because we're going to run out of time. We've got a little over 20 minutes left. So come on up. We're going to impose a 2-minute time limit. Obviously, there's going to be some redundancy in testimony. If you've heard what your testimony is and you just want to say, yep, I agree with everybody else, That's quicker than 2 minutes, but go ahead, sir. Introduce yourself, Mr. Garrett. Go ahead.
There we go. Thank you, Senator Bouchard.
We won't take
What I
that away
said,
from
what
your
I said
time.
was brilliant. So
Yeah. It was the best testimony we've heard all day.
thank you.
Just introduce yourself one more time.
Yes,
Go ahead.
Richard Garrett, State Government Relations Director with the American Heart Association. I've shared with you an email message this morning, so I won't repeat that. To Ms. Bush's point, I'm a person of privilege. Midsummer of last year, my wife was diagnosed with breast cancer, very early diagnosis though, and we came through it all right. She's going to be okay. But a lot of people have to defer treatments or even identifications till long after the point of successful outcomes has been passed. To the points that Senator Bouchard and Senator McCune have made, the American Heart Association is dedicated to preventing healthcare problems. And I think that if we can get some additional time to help advance our mission, which is to reduce dependence on tobacco, sugary drinks, salty foods, get people's awareness of how to treat hypertension elevated, not increase their blood pressure, but increase their attention to that issue, then we can in fact reduce healthcare costs in this country. So that's what we're dedicated to do. And I thank you for your time.
Thank you very much. Committee, any questions for Mr. Garrett?
Thank you,
questions.
Mr.
Thank you
Chairman.
very much. Our thoughts are with your wife as well. Thank you very much. Anyone else in the room to testify today? If not, let's move to virtual, Amanda, and go ahead and admit 3 or 4 people in. To each of these people, we're going to have a 2-minute time limit on your testimony. We'll be cutting off at 9:40 so we can hear the bill in committee and take care of and resolve this bill.
Mr. Chairman, we have Dr. Ryan Jackson in. He's ready to testify.
That's great. We know Dr. Jackson quite well. Go ahead and admit him in. Dr. Jackson, beautiful scenery behind you. Go ahead, sir.
Yeah, Mr. Chairman, I'm Dr. Ryan Jackson with the Wyoming Business Coalition on Health, and I also do some work with the American Cancer Society's Cancer Action Network. And we are wanting to support this because, as many have said, you can be conservative fiscally and on other issues and still see the value in this. One of the things is many of the people of Wyoming can't afford to get off of the socialized care unless we do this. So if we want to reduce the socialism, then we have to give the people who are making $12 an hour, which would put them still within this poverty line here, the chance to have health insurance, because otherwise there's people who are going to be stuck in lower paying jobs and they're not going to be able to get $1,000 a month insurance, and they're not going to be paying an $8,000 per year out of pocket or more. So if we want our people to be able to have a chance to get off of all of the socialized benefits that people are concerned about, then we need to have this expanded Medicaid so that they can have a chance to have a decent job and be able to have those benefits. We've seen so many employers that are losing employees because they can't provide healthcare because it's too expensive right now. And we support the hospitals. We understand that a lot of their write-offs will go away if we have fewer people using the emergency rooms for sniffles and cuts, because they can actually go to other providers and have that covered. So we support the hospitals, we support the people of Wyoming on this, and this would help the employers of Wyoming. And in the long run, this would be more conservative, both fiscally and in every other way. So.
Thank you very much, Dr. Jackson. Questions, committee, for Dr. Jackson? Seeing none, thank you very much for your presentation, Dr. Jackson. Amanda, who else do we have?
Miss Leah Vader is next.
Okay, Ms. Vader. I almost saw your picture up there. Go ahead when you're ready.
I started it and here I am.
Okay, man. 2-minute clock is running. Give us your best wisdom.
And I've got a 2-minute clock running too on my little timer. I'm from Gillette, Wyoming, so one of the particularly affected communities. I'm a constituent of freshman Senator McEwen and had a conversation with him about Medicaid expansion on February 12th. It was a great conversation. We spoke on kind of my history is I was Minneapolis girl raised by a dad with a degree in US history who became a businessman. So I can speak philosophy and a little bit of business. My daughter worked at Don's supermarket. I've known what it's like to have jobs with and without health insurance. I've known what it's like to be married with and without health insurance just because of the way marriage rights went in Wyoming. But I came home from 10 years of seasonal work to just be in this community with my spouse, who was a coal miner from age 19 till Black Jewel. You know, at age 59, we had no job. The ACA saved us. I want to speak and saying that the ACA was because we were responsible and are able to live on a really low income, hashtag single wide pride, and put away money. We were able to get a no premium plan. Not everybody's that way. So in the last few months, I've been talking to my fellow community members, and I've spoken to business owners like Senator McEwen, who can't afford to insure themselves or their workers. I've worked with Better Wyoming, so I know how when hospitals get paid, everybody's costs go down. Senator McEwen said we have to diversify the economy. Absolutely. Attract businesses by supporting the healthcare that we have. I'm at 18 seconds, and a lot of the healthcare workers I've met have spouses in the energy industry. So let's just keep those families here. I really appreciate this opportunity to testify, and I'll answer questions just as a citizen who's been doing some community organizing. And thank you so much. Beep.
Thank you very much, Ms. Vader. Senator McEwen, did you want to ask your constituent any questions?
Hello.
It's good to see you and nice to talk about this again. I wouldn't assume where I'm going to vote on this just yet.
Okay.
If you want to know the truth, I'm not against the whole idea of this. I just, at some point in time, I think we need a plan at the other end after the 2 years, because I hate to use this analogy, but we're kind of turning into crack addicts with federal funding. And once we start taking all this federal funding, are we ever going to get back on our feet? Are we ever going to fight back and push back on what they've done to the healthcare industry? And once again, I empathize with Senator Office. I really wish I could look him in the eye right now and say, this is how we can fix this. And I appreciate you calling in. Thank you, ma'am.
Welcome, and thank you very much for testifying. Any
Thank you. My final thought is somebody that was in the Army for all those years and is probably getting, government health care. I mean, I'm just an AmeriCorps veteran. I didn't put in the years that you did, but, there's ways that we do work together federally to help everybody in this community. And just, as a Christian and as a loving United States person, let's help our neighbors. And Senator McEwen, I just really appreciate you, and we'll talk some more. Thank you.
Thank you.
Was that a paid advertisement? I'm just kidding. Thank you very much for your testimony. Who's up next, Amanda?
Miss Elizabeth Ridgway.
Ms. Ridgway, go ahead and speak to us. I'll start your clock when I see you.
Am I good?
Go
Okay.
ahead.
Hi, I'm Lisa Ridgway. I'm a pediatrician in Jackson, Wyoming, and I'm urging you to adopt a Medicare expansion opportunity for Wyoming. There are two issues here. One is cost, which has been elegantly covered, and the other is the moral issue, which I and other providers with boots on the ground have to deal with every single day. When I was a medical student at Colorado in the 60s, we were taught that medical care is a right, not a privilege. And in most industrial countries, they have universal health care, but not in the United States. A few years ago, I was working in Rwanda. I learned Rwanda has universal health care. In the United States, I have seen tragic stories of families being hit with enormous medical bills and even worse. And we've heard that today. So people delay medical care, showing up in the emergency room when the situation is so scary or so serious, and then creating a much bigger bill because the situation is worse. A child in Star Valley a few years ago became worse over several days. Finally, in the ambulance coming up to Jackson with a caregiver, the child died before it reached the hospital. I never want to hear that again. And you know what happens to these hospital bills. The hospitals all across the state for $100 million have to write them off every year. I know a family in Jackson who's had to move to a small apartment and rent out their house to pay the bills. And we've all heard of COVID-19 patients who try to ride it out and quietly die at home for lack of oxygen. I've seen patients in the parking lot at the grocery store here when the moms say they can't afford the emergency room. Would I please look at a swollen ankle, a rash, or a fever? Of course, because if you wait, things tend to get worse. Jackson has many adults in the service industry, as does every county, and we want to keep these people and keep them from moving out of state. But it means if they don't work, they don't get paid. So the past year has put them in risk by going to work. And without insurance, all their chronic problems like high blood pressure, high cholesterol, heart disease, and joint disease get worse.
Dr. Ridgway, we go ahead and get you to wrap up and sum up. I'm sorry to interrupt.
So the resulting bills, when they finally get on Medicare, the damage is more serious, the bills are more serious, and we've heard about that. They've documented in Montana, expanded Medicare reduces crime, improves overall health, and has lowered the state debt. I urge you to pass this bill. Thank you for your time.
Committee questions for Dr. Ridgway. Dr. Ridgway, we appreciate your expertise and your testimony here. Thank you very much for coming to us today.
Thank you.
Amanda.
Yes, Mr. Chairman, we have Miss Deborah Hinkle.
Ms. Hinkle, as soon as I see your face, ma'am, you can go ahead and speak to us. Oh, you're muted, Ms. Hinkle.
Whoops.
There you go.
There we go.
Go ahead and introduce yourself.
Okay. I am Debbie Hinkle. I'm from Laramie, Wyoming. I've been the president of NAMI Laramie for 14 years. I also served on the Albany County Mental Health Board for 2.5 years as the chairman. I was co-coordinator of 6 CIT trainings. I'm a board member of Laramie Cares, which is a suicide prevention group, and I'm a mother of someone that suffered from mental illness. In my position as NAMI Laramie president, I have served or conducted a support group for all these years that is for families of people with mental ill or friends. And I have watched them try and negotiate finding help for their loved ones. There's nothing here. There's so few beds. And then I've also listened to the police departments talk about people with mental illness ending up in jail and sitting there for a full year waiting to be evaluated. If you get these people some help early, there's some hope for them. And when there's no financial help for healthcare, then we end up with the long-term costs of them being in and out of the hospital. And it's far more expensive then having some health care for them so that they can get on medication and they have some sort of a chance. My son was on Medicaid. And Stefan Johansson confirmed this to me. Most people with mental illness have had their Medicaid taken away. Well, if you're trying to survive on $780 and they take away 134, where does that put you? You know, it's hard to eat and pay for an apartment and take care of yourself at all. So are we going to put them all on the street and then have them in and out of the hospital? It's going to cost you one way or the other, and it already is. The costs have increased substantially because of all of these people no longer being accepted on Medicaid, and the emotional stress of that has thrown them completely off, and then they've ended up in the hospital more, or maybe they end up doing something criminally. Our local detention center has a lot of people in there that are mentally ill and they're too volatile to be up in the hospital. Our hospital is just overwhelmed, and we're talking about taking away more beds. We've got to do something with this system so that we are not #1 in suicide.
Thank you, Ms. Hinkle. You want to go ahead and summarize? Or are you finished?
I just think it's incredibly important that we do this. We move forward and we get this Medicaid expansion so it's there for mentally ill and people with the low income.
Thank you very much. Questions, committee? No questions. Thank you for your work with the mental health population, a frequent topic of this committee. We appreciate that. Thank you for coming today.
Thank you.
I see another face. I can't see a name, but I see a face, and she smiled. Go ahead, ma'am.
Mr. Chairman, this will be Ms. Stevens.
Okay, Ms. Stevens, go ahead.
Hi, thank you. I'm Elisa Stevens. I am a nurse practitioner here in Wyoming. And just, I wasn't planning on saying this, but to Deborah Hinkle's point before me, yes, Wyoming has led the nation. We are the top in terms of suicide rates per capita. We have been for the last 2 years in a row. So I appreciate her bringing up that really important point. So again, thank you for giving me the opportunity to speak. As I said, I'm a nurse practitioner here in Wyoming. I earned my bachelor's from the University of Wyoming. And I also would like to support Medicaid expansion. We have now had the opportunity to observe the pros and cons of Medicaid expansion for almost a decade in other states. And there are clear benefits to Medicaid expansion. Uncompensated care costs fell by over 40% in rural states who adopted the expansion within the first several years. Financially stable hospitals is the result of that. And the result of financially stable hospitals is better care for all, not just those on Medicaid. So it benefits you and I to have hospitals that are more financially stable. And this is a really important issue here in Wyoming because rural individuals are more likely to die by the top 5 leading causes of death prematurely than urban dwellers. Increasing access to care results in improved health care outcomes and a reduction in premature deaths. So again, thank you for this opportunity. That's all I have to say.
Thank you very much. Any questions, committee? Okay, no questions. Thank you very much for your medical work. We appreciate seeing nurse practitioners in here very often. Thank you very much. Next testimony, please.
We have Ms. Marcy.
Go ahead and say it again, Amanda. I'm sorry.
Mr. Chairman, we have Ms. Marcy Kindred.
Okay, we're down to about 2 more testimonies we're going to allow in unless somebody's got some new information. We plowed this ground pretty well, I think, but go ahead. Go ahead, ma'am.
Good morning. Can you hear me?
We can hear you perfect. Go ahead.
Great. I'm Marcy Kindred. I'm here in Cheyenne, Wyoming. I'm here to urge you to vote yes on this bill. Last year, after filing our 2019 taxes, my husband and I owed the IRS. And I felt a lot of things. But the most overwhelming of these feelings was immense gratitude. It was the first time in my adult life that I wasn't desperate for a tax return. It was the first time in my life that although it was still tight, I could scrounge up the money to pay that bill. 3 of my 4 children were born in hospitals afforded by my maternity Medicaid coverage. All but my youngest attended all of their doctor's wellness checks and received vaccinations because of Medicaid coverage. All 4 of my children received milk, cheese, fresh fruits and vegetables and supplemental formula provided by our WIC program. I fed my children with groceries purchased by food stamps for almost 6 years. My 4 Wyoming-grown boys are healthy, happy, and thriving. They have big dreams and plans. They will do and create big things for this state. I have no doubt about that. And all of this was brought to you in part because of good old government assistance. My husband and I both held multiple jobs throughout the time we received assistance. Today, I am an overworked realtor. In fact, I'm on an appointment right now in this insane market. But even now, I assure you that I have never worked harder than when I lived in poverty. But we didn't give up because we still had hope, because we were kept afloat, even if just barely. There's this really horrible idea that assistance of any form makes people lazy. Tough love is the way of the West. Pull yourself up by your bootstraps and all that nonsense. But really, the biggest danger is letting people lose hope. It's not laziness. It's the why should we even try that keeps people stuck. My family qualified for Medicaid in its current form, and this bill will target different demographics, but the effect is the same. Many folks, especially after the year we just had, need this. There are people drowning and you hold the life preserve. Giving people a handout doesn't keep people lazy, but giving them a hand up does give them hope. And there are a lot of folks in Wyoming that could use some hope right now. Please don't waste precious time saying there are better ways. We've been talking about this for how many years now? What are the better ways? Where are those bills? I will go and testify for them because we have to do something. This is it. This may not be perfect or your cup of tea, but this is it. Do the right thing and vote yes for this bill, but also do what you have to do to convince your colleagues to do the same. Let the people in Wyoming know that there is still hope, that there are many of us that would be grateful to pay extra taxes. Thank you. I stand for any questions.
Thank you very much for that very passionate testimony, I might add. Questions, committee?
Sorry, I'm out of breath. I'm moving furniture right now.
Testimony. With that, I'm curious if there's anybody in the audience, Amanda, that is opposed to the bill that would like to speak to us quickly. If so, maybe they could raise their hand. Otherwise, I think we'll close public testimony.
Mr. Chairman, I'm going to ask those who have their hand raised to unraise it if they oppose the bill. Mr. Chairman, I'm going to promote the first person with their hand raised. We still have about 10. And
we probably won't get to hear all 10. Let's hear the first, maybe 1 or 2, and move ahead. Go ahead and get the first one.
Mr. Chairman, Marilyn Kinney was just admitted.
Ms. McKinney, go ahead, ma'am. Ms. McKinney, go ahead.
Hi, good morning. My name is Marilyn Kenny, and I live in Laramie County. And I have been a nurse for 50 years and still working PRN at the hospital. So I'm one of those front line workers. And I have, just like the lady, the realtor lady talking about Medicaid, I've seen so many people come in who are desperate and actually need Medicaid. A gentleman came in, his foot is black, draining pus. And I go, what happened? He goes, well, I'm diabetic. I work to make a living for my family. I cannot get health care. I can't afford my insulin. I can't take care of myself. I can't afford the health care here in Wyoming. And it's like desperation. And I can give you numerous people that come in, ranchers, cancer, lost their ranch because they couldn't afford the health care. So what it amounts to is, well, the senator who talked about being in the military, well, guess what? The military is a socialized program. We as taxpayers are paying for your health care. And socialized medicine and taxes are not bad. And I want this Medicaid expansion to go through. And I don't care about, I would love to pay taxes for our educational system and healthcare and help these people out. I am on Medicare and ARP. My husband just died of stage 4 lung cancer, 4 years. Guess what? I did not see one bill on normal healthcare system with healthcare from the hospital. I would have had to pay, I don't know how much money extra to cover his healthcare. So socialized medicine, which is Medicare, is not a bad deal. And all these senior citizens out there collecting their Medicare, don't dare touch that. I love my socialized medicine, Medicare. And all I can say is, if you look at the state of Kansas, they did not want Medicaid expansion. They did not want taxes. And look at the state of Kansas. They went down. So if Wyoming wants to be smart, then let's get with the 20th century and figure out what we really need to do to help the people. Okay? I am sorry I went off on you people, but I am frustrated at this point as a nurse. No.
Thank you very much. Thank you very much, Ms. McKinney. We appreciate your comments and your passion.
Okay, thank you.
We appreciate your 50 years as a nurse. Anybody who does that deserves a break. And will you do me a favor? Will you give your dog a treat and say it's from us?
Yeah, thank you.
Thank you very much for testifying.
Okay. Bye-bye.
We're going to go ahead and close this to public testimony now. Senator Rothfuss, would you like to come up and wrap this up for us? Actually, yeah. Senator McLuhan, or McEwen. You know, it only takes me 2 years to get names right, Senator McEwen. Go ahead, sir.
I just want to make a comment. She's absolutely right. The military is healthcare or socialized healthcare. And until any one of you have been to the VA, you might understand it's not all it's cracked up to be. Thank you.
Okay, Senator Rothfuss, take us home.
Mr. Chairman, very briefly, because I'd like you to have the opportunity to work the bill. I would ask you to move this out of committee to the floor for a larger debate, even if you end up opposing it when we get to the floor in the third reading, because this is important, obviously, to the people of Wyoming. I think we heard that just now. It's pretty clear. And what I would say, the biggest challenge, I just don't disagree with the fact that this is a great or problematic system, which is what the concern is. We know we have a tremendous number of flaws. This doesn't solve the flaws that we've identified. It doesn't. And we're going to continue to struggle. And each of the challenges that was identified in discussion today, those are real challenges and they all need work. The struggle I have is that we're taking a principled stand against the poor hand that's being dealt to us by the feds, not with our own health care individually, not with our own access. I'm fine. Got great insurance. I'll be okay. My family's going to be okay. I'm fortunate. We're taking a principled stand with the lives of 25,000 Wyomingites that don't have the luxury of sitting here today having this chat. Folks that are our working poor, the single moms we heard about with 2 kids, probably have to have 2 or 3 jobs, the mentally ill. Those are the lives we're playing with. And we've offered them nothing for the last decade. I've run legislation to try to reduce costs. I've run legislation to try to increase transparency. I've run legislation over the years to try and reduce Medicaid fraud. I'm trying to address the cost side. The cost side is a tremendous problem. This actually helps it in Wyoming? Probably not substantially, but we know that when we talk about the uncompensated care, that we can do some things through Medicaid expansion that reduces it. Plus, honestly, bringing in 80 million additional dollars to the state helps our general fund, and bringing in a few $100 million a year of additional revenue does help to dissipate the costs in a positive way. But at the end of the day, I hope you'll support this because of that question, right? These are 25,000 Wyomingites that we have failed to provide solutions for year in, year out since I've been in the legislature. Each and every year, they've come to us and asked. Each and every year, we've said, no, not this. And each and every year, we have provided no solutions. And I'd remind the committee one last time that it's not as if there are alternatives on the table. These folks are ineligible for the subsidies through the ACA for the insurance exchange. They have to pay full cost of insurance, which for single individuals is over 100% of their income. Tell me how you pay the premiums on the insurance when it's literally more than your income. I don't know. I don't know that math. So I'd ask you, even if you still have concerns, even if this still isn't your cup of tea, that unless there is a solution that you have in mind that we can pull off this year, let's step forward with this one. Let's take it to the Senate. Let's have that debate. Thank you, Mr. Chairman.
Thank you, Senator Rothfuss. Committee, do I have a motion? Senator Furphy moves the bill. Discussion committee on the bill. Senator Bouchard's reaching for his mic. Go ahead, sir.
Thank you, Mr. Chairman. You know, what I really heard a lot of was people want socialist healthcare. I obviously had a lot of problem with the Affordable Health Care Act, and very vocal about that in those early days. And we're at a point now where it's not so affordable. And it just seems every time the government is involved, it gets worse. So I'm just not convinced of going to socialized healthcare and moving this into that realm. I think that there are probably some things that we could do. We could start looking at what our costs are and really looking at them, because that every time we do that, we keep hearing other excuses of why we shouldn't dig deeper. But anyway, I'm just having a hard time here. I haven't heard anything that didn't say we weren't going to just move further into the universal health care block, and that is a big red flag for me. So,
Further comments, committee? Everybody's got their hand like they want to touch their mic, but nobody's touching it. Go ahead, Senator Furphy.
Thank you, Mr. Chairman. Well, I served on our hospital board for 8 years. And believe me, we tried to get those costs under control. We looked at them carefully, but that is a huge issue. And it goes beyond what this bill is trying to address. And I can say our hospital had so much uncompensated care because, as was testified, these people who can't afford insurance, they go to the emergency room, the most expensive form of medicine. So it puts pressures on the hospital. It puts pressure on private insurance that has to make up for some of those costs, et cetera. So I'm with you. This is a big issue, our costs, but we, for now, have to take care of these 25,000 people who have no care in our state. And so we also heard testimony, if it becomes too onerous, we can back out of this program. So I'm big on taking this to the floor. Let's discuss it. Let's do something for these people. Thank you, Mr. Chairman.
Thank you, Senator Furphy. You're the only one left. You got any good, kind words or words of wisdom for Senator McEwen? He's saying no. Okay. I would just add again, I say this is the seventh session. We've talked about it. I encourage bringing it to the floor. I think it's a healthy discussion. We may not all agree with it idealistically, but I think it's an important discussion to be had. And more people now than ever before. And I would ask the additional thing to the Hospital Association for future meetings, if they would bring us some figures on uncompensated care, compare some past years, compare the pandemic year, because I'm curious if we can get any indication of what's happened or what's changed. With that said, if there's no further comments, let's do a roll call or vote.
This is for Senate File 154. Senator Burchard. Senator Furphy.
Aye.
Senator Hutchins.
She left a no.
Senator McEwen.
Aye.
Chairman Baldwin.
Aye.
You have 3 aye votes and 2 no votes.
Thank you very much, committee. You've got 6 minutes left. You won't get your picture taken yet, but you got time to walk to the floor.